Adrenal gland is releasing high level of the cortisol. The gland is under the stress. The cells are basically producing and releasing the hormones, so cells are under the stressed condition. Now, they are overworking, overburdened. To cope up with this overburden, what happens? The cell will try to expand. They will increase in the size. That will lead to the hyperplasia, and this overactivity can be due to the tumor and can be due to any hyperplastic condition. Now, taking this into consideration, that the cell's shape is changing, the structure of the cell is changing, the component of the cells that are present inside, like the lipid is present inside, like the other part of the cells, they are changing as well. So taking all of these things in consideration, we can say that there are obviously some morphological changes that are specifically associated with the hypercortisolism. Among that, the hyperplasia and atrophy is the most common one. Now, let's see what are the other changes that are associated with the hypercortisolism. Now, this is the normal gland. You can see this is the size of the normal adrenal gland. It has some nodular parts, but they are normal, and it has the normal structure, and this is the normal size of the cell. Now, if you look at this diagram, you can see here the cells have diffuse hyperplasia. Now, hyperplasia means that the size of the adrenal gland is increased because of the overburdening. However, in case of simple diffuse hyperplasia, the cell surface is still normal, plain, and there is no nodule present there. When there is hypercortisolism due to some iatrogenic cause, there can be the diffuse hyperplasia that can be seen inside the body, but if there is no tumor, then you will not observe any nodule on the surface of the adrenal gland. These nodules on the surface of the adrenal gland, they are due to any adrenal tumor or adrenal neoplasia. Now, this is the simple hyperplastic condition of the adrenal gland. If you look at here at this diagram, now this is showing you the primary cortical hyperplasia, and this is due to the adrenal tumor. Now here you can appreciate the different nodules. These are the nodules that are formed inside the adrenal gland, and these are due to the tumors or the cancer of the adrenal gland. And you can also appreciate the microscopic changes here. These granules that are present inside the adrenal gland, they are not just simple granules, rather they are lined with a special material that is present inside them, and here they are making these areas dark. Basically the lipid is present inside them that is making these areas dark, and you can appreciate the difference between the normal part and the nodular area, or the area which is suffering from the hyperplasia due to the tumor. Now, the third diagram that I'm going to show you is about the adrenocortical adenoma. Now, if you look at this adenomatous condition, you can appreciate that there are no too many nodules. You can appreciate simply a solitary tumor. So this is the condition when there is a giant solitary tumor is formed. And also, if you look at the microscopic features of this, in case of the adenoma, there are no prominent microscopic features, but just that you can notice or you can appreciate here is the vacuole formation. Within the cells, there is the vacuole formation that can be seen only in case of the adrenocortical adenoma. And rest, you will appreciate hyperplasia in all type of the hypercortisolism. You will appreciate the atrophy, and also, as I told you, primary cortisol hyperplasia. These all things will be seen in a patient who is suffering from the Cushing syndrome, and also by noticing that whether there is the nodules, whether there is a solitary tumor, there is the accumulation of any material, or the surface is smooth, or just the size of the gland is increased, you can differentiate between the causes of the hypercortisolism.